morning. My name is Sadia Hussein. I'm an FGM survivor and a champion. I'm the CEO and founder of the PSI family. I'm very happy today because of this SOP, because I was among the survivors who testified with the recent case that we won. Thank you so much. I'm here today from FGM. We could really assist the investigation officer and also the with regards to FGM matters.
Good morning. My name is Meroka Riech, a prosecutor.
Good morning, everyone. My name is Marcy Nyareta. I'm a prosecutor with ODPP. I'm happy about these SOPs because one thing they will do is that they will at least enable all prosecutors to be on one page when it comes with dealing with matters of FGM, charging, making the decision to charge, and how to prosecute them in court. Thank you.
Good morning, everyone. My name is Samuel Kimani.
My name is Justice Lee. I'm a prosecution counsel with ODPP.
All right. We have everybody on the floor. Thank you. Thank you so much. You can see from the introductions, you can see how committed we were to have these SOPs started. And where we are getting to is that the SOPs, you can see they are enabling us to have some sort of an approach where we are focused on ensuring that we have a coordinated, focused, and in a manner in which where we can be able to know as a prosecutor, who do you deal with, who do you talk to, so that when we are dealing with investigations, you don't have a problem with who to approach or whether it's the children's department. So for me, this is a 21st century approach in how we can be able to manage matters which deal with FGM. So for me, I'll be left to first of all introduce our first guest. That is Ms. Asenet Mwitaga from UNFPA. So Asenet, over to you.
Thank you, Jacinta. The Office of the Director of Public Prosecution, representatives from the Judiciary, the CEO and the FGM Board, the County Commissioners and the Deputy County Commissioner present, partners, distinguished guests, also ladies and gentlemen, good morning. Good morning. My name is Asenet Mwitaga. I am the coordinator of the UN program on the elimination of FGM. I'm also seconded to the FGM board as advisor to the CEO, and I'm also the national focal point on ending FGM. As the UNFPA, on behalf of the United Nations Population Fund, and on behalf of our country representative, Dr. Adebola Olajide, we are indeed pleased to join the Office of the Director of Public Prosecution and all stakeholders represented here today in the validation workshop on the FGM Standard Operating Procedure Manual. We further wish to acknowledge the efforts put into this process and congratulate the Office of the Director of Public Prosecution for the leadership and for steering this process forward to ensure that the SOPs are developed, whose main objective is to standardize and bring consistency and efficiency in investigation and prosecution of FGM cases through provision of general principles that prosecutors and law enforcement officers should adhere to in the conduct of FGM and harmful traditional practices cases. We have witnessed so many challenges when we are handling issues of FGM, investigation processes, and prosecution of cases. And to an extent, some of these cases have been thrown out of court due to insufficient evidence to prosecute. Maybe because an investigating officer did not secure the crime scene, and therefore evidence was tampered with. The challenges of witnesses refusing to come forward due to fear of confidentiality, sometimes bail granted to perpetrators, and therefore they go back to their communities and continue with the practice. And therefore, these SOPs have been developed to streamline some of these challenges and issues, and also to strengthen such investigation and prosecution processes, and have an outlined processes and procedures that will be undertaken when dealing with FGM and harmful practices cases to ensure that prosecutors and law enforcement officers are aware of and protect the rights of the victims and witnesses. For us as UNFPA, our work is aligned to contribute to very transformative results. We work towards zero preventable maternal deaths. We work towards zero unmet need for family planning and zero gender-based violence, and more harmful traditional practices, including FGM and child marriage. And as we contribute to zero gender-based violence and more harmful traditional practices, we also align to the presidential commitment on the elimination of FGM in Kenya by 2022. And therefore, we start high-level political commitment and goodwill by the executive. We also need to strengthen the investigation and prosecution processes and nurture linkages, collaboration, cooperations, and strengthen coordination among stakeholders involved in the elimination of FGM, so that we can be able to contribute towards the attainment of zero FGM, and therefore promote the rights of women and girls, and also contribute to the achievement of gender equality. So as I conclude, for us UNFPA, we have been delighted to be involved in this process as a support partner, and do wish to reiterate our commitment to working with the Office of the Director of Public Prosecution to support towards the elimination of FGM in Kenya by 2022. Thank you.
You have spoken so well. Let us give another round of applause. Thank you so much, Madam William. I hand over the microphone to you.
Thank you so much, Asena, for giving those opening remarks. Thank you for pledging to continue supporting us. Indeed, UNFPA has been supporting the ODPP in terms of the FGM and the related cases. And now call upon the CEO of the Anti-FGM Board, Madam Samuel Kimani.
The Office of the Director of Public Prosecution, County Commissioners, the Ministry of Labor and Social Protection, the Anti-FGM Board team. We have ACAP, represented by Dr. Kimani, World Vision, our survivor and activist, Sadia Hussein from Tana River, and all protocols observed, our media. Good morning. Good morning. Yeah, I'm very, very glad to be here this morning. And I'm really delighted that we are able to come together to make sure that our girls and our women are safe from FGM. As we are already aware, female genital mutilation is the worst form of gender-based violence meted on women and girls. According to the Kenya Demographic Health Survey 2014, 21% of women in Kenya and more than 4 million women and girls in Kenya are living with the negative consequences of FGM. And every minute and every second and every day, the girls are going through this pain and suffering, and they will live with it for the rest of their lives. In this room, we have survivors of FGM. but you know it's not written on the face that you are a survivor. Because if it was an ear that was being cut, or a nose, or a leg, at least we'd see that someone has some kind of disability. But it's a hidden part of the body, so you'd never know that who is going through the pain and suffering. And according to our cultural way of living, we were not supposed to speak about that. We were just supposed to go quiet because it was not allowed. But now in this century, we want to say it very loudly that no more girls will go through FGM. These SOPs today for us will really make a very big difference in the campaign to eliminate the FGM. As Anti-FGM Board, we are honored to be part of this workshop on validation of the SOPs for prosecution of FGM and harmful practices. This initiative would not have come at a better time than this, when we are implementing the Presidential Directive to end FGM by 2022. I want to take this opportunity to sincerely thank the Office of the DPP for working with us in this journey to realize the presidential vision of ending FGM. As you may be aware, the implementation of the Presidential Directive to end FGM by 2022 required a multi-sectoral approach, which necessitated us to have structures from the sub-county level to national level, drawn from relevant government ministries, departments, agencies, county governments, communities, partners, and other stakeholders. You may also be aware that a multi-agency technical committee from the Ministries of Health, Education, Public Service and Gender, ICT, Innovation and Youth, East African Community, Labor and Social Protection, Engineering and Coordination of National Government, and the Office of the Director of Public Prosecution, and Anti-FGM Board as the coordinating agency was formed in September 2020. On this note, I wish to thank the Office of the Director of Public Prosecution, Nuruddin Haji, for allowing your officers that have been working with us and have been assisting us in this noble initiative. I will not also forget to thank your organization or the ODPP for coming up with the anti-FGM unit. Despite the progress we have made, despite the progress we've been able to realize as a result of collaboration in prosecution of FGM cases, there are still some gray areas which require further streamlining, which include poor reporting of FGM cases. Obviously, sometimes we don't expect our communities to report because FGM happens in household level and the perpetrators are the family members. So we find that we have a very big challenge with that. We also have interference with witnesses. We know that the person who takes you through FGM is either your mother or your father or your cousin or someone that is very close to you. So most of the time you are told that you should not go and witness against your father because you'll be cast. So there's a lot of interference with witnesses. We also have a challenge with the medical reports. I hope the Ministry of Health is represented here. We have a lot of challenges with the medical reports. When the girls who have been cut are taken to the hospital so that they can be checked and then the P3 form is filled, sometimes the medical officers don't fill the form as it's required. So we've had challenges of the prosecutors by the time that the P3 form gets to their desk, it's wrongly filled. So this is an area that we've also had very major challenges, and we are working with it with the Ministry of Health. Piecemeal investigations, where the investigating officer concentrates with FGM offenses and not the connected offenses. As I had said earlier, poor drafting of charge sheets and P3 forms. That's an area also that we have a challenge. Poor gathering and preservation of evidence. I know this is something that we need to continue creating awareness. Requires formulation and adoption of SOPs. I know the police had already launched their SOPs, and issues of FGM also came into place. So we need to see how both SOPs can be interconnected. The SOP is important for us because it will allow our organization, which deals with carrying out interventions on FGM, to systemize their processes, keep all team members and other stakeholders on the same page at all times, and move forward in a singular, cohesive manner. Indeed, it will standardize and bring consistency and efficiency in investigation and prosecution of FGM cases. This SOP will foster better collaboration, cooperation, and coordination among stakeholders involved in the fight against FGM by allowing seamless operations between the frontline law enforcers, that is the chiefs, the police, and the prosecution counsels, magistrates, and judges, so that they can carry out their work expeditiously with the sole aim of finalizing judgment of FGM cases. So the SOPs will really come at the right time, because the challenge we've been facing is coordination between the time the FGM case happens until it reaches court. So we need to see how we can make sure that it's very seamless. Before I conclude, I wish to single out the roles of the DPP and law enforcers in the implementation of the presidential directive. As I had said earlier, we have the presidential directive, a costed action plan in place that we are implementing, with also the office of the DPP is part of the multi-agency technical committee. So the role of the DPP, number one, prosecution of those charged by the police and other investigative agencies with criminal offenses, including FGM, while upholding, protecting, and promoting human and constitutional rights. Take over and continue any criminal proceedings instituted or undertaken by another person or authority. Ensure due regard to the public interest, the interest of the administration of justice, and the prevention and avoidance of abuse of legal processes. Represent the state in all criminal cases, criminal applications and appeals, and compiling relevant data. We've been working with the Office of the Director of Prosecution to do our monthly reports to the Presidential Delivery Unit, which is one of the requirements of the Presidential Vision to End FGM by 2022. And I want to thank the Office of the DPP, because we've been able to have enough statistics that have gone into that report. The third report was just sent last week to the PDU. Number two, we have the law enforcers under the Ministry of Interior and Coordination of National Government. Their role in this directive is enforcement of the Prohibition of Female Genital Mutilation Act 2011. That's the chiefs, assistant chiefs, to work with the police and make arrests perpetrators of FGM, create public awareness on FGM, and ensure that chiefs and assistant chiefs register and report all cases of FGM in their areas of operation. So since the multi-agency technical committee was put in place in September 2020, we've been working very well, seamlessly, and at county level, I'm very proud to have the county commissioners here who are the chairmen of the county anti-FGM steering committees. They've been working very well and coordinating anti-FGM campaigns, and the Office of the Director of Public Prosecution at the county level sits at the county anti-FGM steering committee. As I conclude, I wish to recognize the organizations who have been supporting us, who have been working with us, especially with these SOPs, and we have UNFPA that has supported the process of coming up with these SOPs. I would want to urge us, as we validate these SOPs, we need to move very fast to make sure that we complete this process. I know Asena is here. She is in my office at the moment through UNFPA. And with the Office of the Director of Public Prosecutions, if we can move very fast, launch these documents and roll them out. As Anti-FGM Board CEO, I promise with our partners to be able to work very closely with the Office of the DPP to roll out these SOPs to the counties. Thank you very much. Oh, sorry. I thought it would be very cold in the morning. I've had a bad cold during the weekend and had my second jab 1 week ago, which has been a lot of stress. Yeah, so they want to take my photo without the mask. I'm here. Yeah. Thank you very much.
Thank you so much, Madam, for just bringing us up to speed, especially with regards to the presidential directive and the different roles of the various agencies that are present here today. I heard you ask whether the MOH is here. Indeed, they are here. We have a representative from the MOH, and we also have a representative from the IG. And with that, I'd like to call Madam Judy Jebet, Assistant Inspector General come and give her remarks.
Protocols officer. My name is Judy Lamet. I'm the Director, Community Policing, Gender and Child Protection. I just want to say I don't have any notes. I've just been called from there and told to sit here. But that doesn't mean I don't have anything to say about FGM. First, let me say that this document, the SOP that is being validated today, is a very important document when it comes to dealing with matters of PPD and not to say FGM. This is because we already have our own SOP as the National Police Service. So what I would want to see is what is the connectedness. How are we going to deal with it? How do we stop from us and it goes to the DPP so that they can prosecute it? It's a very good thing and it is timely because during this time of containment measures, we have experienced a very high rate of GBV cases in the country, and FGM is one of them. I also wish to say that the prosecutors cannot do the work before the matter has been investigated by the police. On it. Community policing is key because as you have heard, FGM happens in confined spaces. FGM happens with the support of the family members and in secret. And in the modern policing way is that it is supposed to be police and public partnership, because then they know what is happening. Not necessarily even the immediate family members, the neighbors in the community know that. So it's very important that we as police officers, community policing with the members of the public so that we can be able at least to become proactive. Most of them, we talk of how we can handle issues of FGM. But community policing is supposed to prevent FGM from happening in the first place by giving information and by making sure that at least our girls are safe. We have also received some complaints from some communities about the boy child. And in this case, we are talking of female genital mutilation. Maybe with time, we may need to relook and see, are there really issues within other communities? Because there are other communities that may not be practicing circumcision. So if you post them, what happens? And there are those that are also under those very severe, I don't know, they go to the river and we have received some complaints of some sort. So I'm saying maybe in future we need to include the boy child. I also wish to say that there has been a lot of interference by family members when it comes to witnesses. You arrest them, nobody comes forward to give evidence in court, even to record statements. And when you tell them, they say, I'll be an outcast in the community. So this also calls for a lot of awareness to the members of the public on the effects of FGM, because they are devastating, from death to permanent impairment, permanent emotional trauma. The list is endless. So what we would wish is that for all of us, as we prosecute, we put all these things in our mind so that we are able to know that the person we are dealing with, the survivor, has some fundamental principles. They are already traumatized in all aspects of life. Some of them have even suffered HIV. So in our SOP, the fundamental principle for handling survivors of FGM, one of them is their safety. We appreciate that we have some safe houses within communities, but we don't have a government safe house. So we as police officers suffer a lot because we have a person, a survivor has been brought. You take them to the hospital, and maybe the hospital is far, or they have already gone to the hospital, and then after they are brought to you, they don't want to go home. Where do you take them? We have to look for private safe houses or rescue centers, and that has been a challenge for us as police officers. We had a case where we took a person, a child, and the safe house said, do you have a COVID-free certificate? We have other girls here where we can't receive her. And you're sending this to a police officer who has used a police van to put a straight to that safe house, and they're saying no. But anyway, we struggled for the whole day, and this person is not a suspect. He's a survivor, so you can't put them in cell. Where are you going to take them? You are with this person at night in the police station. Where do you take them? What do you feed them? We feed the prisoners meal. So there's no fund for that. So my plea would be also to the government in future to ensure that they have a safe house that belongs to the government where we can take some of these survivors. So the other issue is confidentiality. I'm sure we have been blamed, maybe for leaking some information about the survivors, but it is a key principle when it comes to FGM, respect, and ultimately ethics and integrity. We are coming up with a one-stop center at Nairobi area. It's called Polycare, Police Cares, and it means priceless dignity for all forms of GBV, where you just enter. We are planning to see if we are going to have a prosecutor and a court and a psychosocial support, forensic people, and a medical doctor in one place. Because most cases, victims or survivors of FGM and GBV are moving exits. Because you're told, don't shower. The doctor needs to examine you. So when it comes to issues like that, it means you are told, go to the lab is upstairs, go downstairs, go to the police station. By the time you take a shower, you have really been humiliated and so much. So all in all, I'm saying it is important that we have this SOP for the ODPP, and I'm sure it's going to help us as we work together with them, as police officers working together with ODPP. So thank you very much for all that I've said.
Thank you, Madam Deputy IG, for giving us some of the challenges that we're facing in the ground, and also proposing way forward. I'm hoping that the rapporteur is taking the advantage and noting some of those challenges and also the proposed mechanisms to deal with them. So now that we have a multi-sectoral approach in here, I have the privilege to call a representative of the county commissioners, that is Dr. Omar Ahmed, to come and give us their perspective.
Thank you for the opportunity. Yes, my name is Omar Ahmed. I'm County Commissioner in Game Market. And on behalf of my colleagues, I want to say that this is a very good opportunity for us to tell all the participants in here what really happens in the counties. And let me start by saying that the FGM problem is actually a big problem, bigger than anticipated here. We see things that you guys here in Nairobi don't see. In Game Market, West Pokot, Samburu, and other counties that have not been represented here, some of them, I believe, Tana River, the northeastern, experience a lot of this stuff. Even in Narok, where I was working before. I want to say that prior to the FGM board and prior to the active participation of many government agencies, I think the problem was bigger. bigger. We would work very hard with all stakeholders, trying to ensure that the culprits are apprehended and we have these cases passed through the law enforcement agencies until the end, so that we have them behind bars, those who are behind all this stuff. But now I think it's becoming easier with the committees in place. We're able to, routinely bring them together, review our challenges, see, how much progress we are making in the counties in terms of having people sensitized, in terms of, reminding them of their roles. And more so when it came to the anti-FGM law, things became easier for us. You'll be surprised that it's 2012 when it was enacted, yeah? Yeah, up to now, up to very recently, very few law enforcement officers knew anything about it. Recently, we had to call upon Madam CEO and the chair of the board to help us carry out a training program, a special kind of a training program for all stakeholders in Marakwet County. And I believe the same will be rolled to all other counties that are affected. I'm told during these trainings, OCSs clearly say that they were not aware, some of them were not aware of the law, and they were using other lenient laws to have the perpetrators get justice, and those, of course, those who are affected. So I believe having the law in place, having the SOP in place, the committees in place, creating a network even beyond the committee membership in the counties than we've been doing in the past. In Elgeyo Marakwet, you'll be surprised to learn that it's not only the girls that we're talking about, it is women who are living 40 and above. We had a very strange case about 6 months ago when two women of over 30 years old in Tambak area, and this is KO, not Marakwet. We used to think that the KOs have done away with this kind of practice. But we realized that recently something has been brewing among the KO community, and it's coming back. So when we were told about the incident, the law enforcement officers ran very fast, did their job, and the husbands to the ladies, they came out and said, we don't get our place within the elders, committees or councils to discuss key important issues within our community, because we are always dismissed simply because women have not been, circumcised. They use the word circumcised instead of, we talk of mutilation here, then they talk of circumcision. To me, I've read many books of faith, and even in the Old Testament, it tells us clearly that the covenant between God and Abraham was about men and boys circumcision, not about women and girls. Am I right? So I told them as Christians, this should not have been the case. And another problem is also among us Muslims in many other places. I think the story is the same. So we get challenges there as we try to talk cultural practices, issues of culture, issues of community involvement is something that is very important. So in the Elgeyo Marakwet and many other counties, as we've been saying, we don't have rescue centers. Even if we rescue some of these girls, we have nowhere to send them to. And they're afraid of getting back because secretly it will be done. You'll be shocked to hear that at one time an HTC of mine was in a matatu from Nairobi going to Elgeyo Marakwet, and she sat in the midst of two university girls, Marakwet girls, and they were happily talking about now being made into women. They were tired of being girls. They were going home to be made women. So these are university girls. Can you believe that? they are happy that they're going home to be made men. So something that we change because of imparting knowledge and skills, but we should get deeper than that by trying to change also the mindset of people as we train them. I wouldn't want to take much time, but I think we need rescue centers in almost all counties that are affected. We need continuous sensitization programs. And for those counties that have not activated their committees, I think it's time that they do that. I think we also need to engage the media continuously, especially the local media, about this anti-FGM practice. The chiefs and chiefs, and there were days when in Bakumi, they need to be activated. You know, their minds have to be always busy about it. Before the COVID, we were busy in all barazas, talking every time, repeating the same gospel. But now with the COVID, we can't have big barazas anymore. But we do it when we have those smaller meetings. So, in brief, that is what I really want to say. And I really want to say that congratulations to all those stakeholders, especially the ODPP's office, for this function. I think this will give us a lot of value in what we're doing. Thank you. God bless.
Thank you so much, Dr. Mark. And thank you. And we can see that there's one thing that's running through the issue of the protection. How do you get the children to be protected? How do you come up with the witness protection mechanism, the safe houses, and not giving evidence of fear, of intimidation, or threats? So, as I told you earlier, this is multisectoral, so I would like to call upon Dr. Samuel Kimani to give us his remarks.
Good morning, colleagues. Am I audible? Yes. Okay, all protocols observed. I recognize the presence of the FGM board CEO and the rest of the team from ODPP, UNIPA, my colleagues. I'm Dr. Samuel Kimani. I work for Africa Center for Coordination Against FGM, a center hosted at the University of Nairobi, College of Health Sciences. So basically what we do is we do generate evidence to inform policy programming and investment in terms of FGM and FGM interventions. And this is a center that has been established for the last 10 years. We work with the likes of Professor Jambesa, who are the pioneers of this work in addressing and trying to mitigate the harmful impacts of FGM. So what I want to say is I want to thank the ODPP because I think this is the right step in the right direction. And you guys are the first to do such a, from our research, we don't have an SOP in Africa. I think you'll be the first people to have one. And we commend you for that. What is more important is the evidence that we are getting in terms of FGM, that even as we develop this SOP, let the SOP be live for a good reason, that FGM is mutating. It's not the FGM that we knew 20 years ago. Today, things have changed, and I would want to point out 3 things that have changed. One is the severity of cutting. So the girls used to be cut type 1 and 2 and 3, or even the severe type. Today, they are even being cut very small, and it's very difficult even for the doctors, as it were, even for the prosecutors and law enforcement to be able to know. So we need to be live to that, so that as we come up with SOPs, we can be able to address that. The second thing is a change in terms of who cuts. All right. We know most of the time the cutting happens and it is done by the traditional cutters. Today we are seeing more and more healthcare providers taking part in this. And this is what we call medicalization. When you have doctors, nurses, and midwives cutting girls, it is medicalization, but it's still FGM. So we need to see how can we be able to capture those practices in the new SOP, and how can we be able to prosecute. And of course, some of the challenges being like doctors and nurses are held at a very high esteem by the community. So if a doctor cuts a girl, any other person will say this is a new normal. It's a swag. If it's done by people who have authority in the community, then we can actually be able to do that. So we need to think of how we can do to look at that. And then the final thing is there is a change in terms of the age, in terms of how girls are being cut. Previously, the girls were being cut because it's a rite of passage. Immediately they are cut, then they go to marriage and they become adults as young as 3 years. So the question is, what is this kind of FGM? This is not a rite of passage. It is something else, and we have seen this a lot in some counties. And then we would probably even be able to pick what are the hotspot counties, like for medicalized FGM, like Kisii County, Narok, Nairobi also, and Kajiado. Those are areas that we need to think about. Then the other thing that I would say is we do generate this evidence, and we inform mostly the healthcare providers. In the Minister of Health, and I'm not holding brief for them, but I know we are working together with them. We have developed tools to build the capacity for our healthcare providers, because we know that has been also a weak link in terms of addressing FGM. And some of the tools are, of course, cascaded from the WHO up to the national level. The Minister of Health has medicalization, that there is no healthcare provider who should participate in cutting girls. There is no hospital or even a clinic that should offer services in regard to this in the community. Report, and I'm sure you're going to be helped. The other thing is capacity building in terms of even working with other multi-sectoral players, so that we can make sure that we work together. Like some of the issues that have been addressed here, like evidence in terms of how to present evidence to the court. That has been a weakness, but it is being addressed by the Minister of Health. One of the things that we know, for example, the question would be, if you go to a clinic or health facility, can you be able to know the number of girls who are cut in the last 1 month? That's a question I will pose to you. The answer is no. Are you able to know how many women who gave birth and had FGM? Probably the answer would be no. So those are some of the challenges, and the Minister of Health is actually working very hard to develop this information for planning purposes and for programming purposes. And finally, then we have also seen a lot of vibrancy at the county level, and these will point to 2 counties, Migori and Kisii, who have already been able to develop what we call, it's a holistic approach that requires what are the services that you need to implement to prevent, to protect, and care for girls who are at risk of FGM. So they have that. They have also what we call a cost-aid action plan for FGM, and all the multi-sectoral approach are integrated there. And I think that is a commendable job. So I think with all the representatives from the counties here, including the county commissions, we can challenge ourselves moving forward in terms of other counties. And finally, we are talking about a lot in terms of prevention of FGM, especially protecting girls from getting cut. The question would be, what happens to the women and girls who are already cut? They need care. They need care, and therefore all the other players are called upon so that we can respond to that need that has been identified in terms of physical care, in terms of psychological care, in terms of psychosocial support. And I think some of those components are well covered in the cost-aid action plan and the minimum packages that we are referring to. The national policy of eradication against FGM by the anti-FGM. So for me, I think that is what we do. Those are the evidence that we have. I think the field is live for everybody to participate and be able to achieve what we can be able to achieve. By the end of the day, is to make sure that we do not continue with this harm must be upheld. Thank you very much.
Thank you so much, Dr. Samuel, for the remarks on this and bringing up the aspect of the medicalization of FGM. And I am happy to report that I quickly perused through our SOPs, and I think they've also taken good care of that.